I've seen dozens of pieces of research on MS and the cannabinoids over the last couple months, and this is absolutely one of the most useful, helpful things I've ever seen for doctors and for patients. I'm Lex Pelger. I do can education for CV Sciences, the makers of Plus CBD, has these excellent sprays that have 2.5 milligrams of THC and 25 milligrams of CBD. These also come in gummies. These are wonderful for older people dealing with stuff. On the cannabinoids, especially with neurodegeneration, ask me anything. So there's a very good reason that there's more data for MS and the cannabinoids than for almost any other major disease. And that's because it sits in the middle of the Venn diagrams of autoimmune disorder and neurodegenerative disease. And those are the two circles where cannabinoids are most effective. They help to calm down an overactive immune system, and they help to protect the brain. And in the case of MS, your brain's own immune system is attacking these myelin sheaths. And these sheaths are what allow the nerves to conduct electricity. And so it is a general breakdown when you can't transmit your nerve signals like this. We have a lot of studies in preclinical models showing that CBD and THC help with the rebuilding or protection of this myelin sheath. And then in patients, you see all kinds of symptom relief. The reason that I appreciate this study that just came out so much is that it is a case series. It simply followed 12 patients before starting a nabiximols, Sativex, which is a 1-to-1 THC CBD spray that gives about 5 milligrams of total cannabinoids per spray. So it's a little bit like this right here, except this has more CBD. The researchers purposely chose a representative sample of MS subtypes, such as secondary progressive MS, relapse remitting MS, or primary progressive MS. And now, check out this list of symptom relief and see why I get so passionate about this subject. After treatment started, 9 of the patients reduced or eliminated at least one of their other anti-spasticity medications, with the shaking. 8 of the patients experienced spasticity reductions of over 30%. One patient was a complete non-responder. There's always a few of those. Let's be honest about what happens, but you should try. Pain scores reduced in all of the patients. And in the 7 patients who were experiencing bladder dysfunction, 6 of them saw that go down. On 8 of the patients, their walking distance improved. And in the patients having sleep problems, 3 of them resolved completely and improved for all of them. 8 of the patients reported an improved quality of life, and for one of the patients, things became worse because of persistent adverse effects of dizziness, apathy, and nightmares. That can happen for people. But overall, the quality of life for these patients went way up. But the last thing to note that makes this so special is the authors wrote a paragraph at least about each of the patients and their experience. That's what makes it so inspirational for other patients and helpful for doctors. Overall, for this paper, mwah.